Thank you for joining us. Today I have Dr. Judy Rose, who is the National Director of PET CT for RadNet. Thank you for joining us.
Thank you for interviewing me.
So tell me exactly what a PET CT scan is.
Well, PET CT scan is a specific piece of equipment that's a marriage between a CT scan, which is an anatomic picture of a patient, and a metabolic picture, which is the PET portion. Those two are two different modalities that are put together in one scanner and show us both anatomy and function or physiology of the patient. And that means for a patient who we're looking for cancer, which is the major reason for doing a PET CT, we can see metabolism of the cancer. We can see how it's functioning, not just a change in size, but is it actually an active cancer or a non-active cancer?
Okay. And then what can a patient expect when they're having a PET CT exam?
Well, the patient will arrive at the center with a certain set of instructions. Because we're going to be injecting something that's a radioactive substance, but it's actually sugar. So we have to have you be without any food or water for at least 6 to 8 hours, because if you eat a candy bar, that sugar will interfere with the sugar that we give you and our ability to see the cancer. So when you come in, you'll have a PET CT technologist who is a specialist in performing this exam, and they will give you an intravenous injection of radioactive sugar. Now it takes about 45 minutes for that tracer to localize in the cancer and in some normal structures. So we do see your brain because you need sugar to think and talk, and we do see your heart because it's very active in the muscle for pumping blood. So we see other organs, but to actually get to the cancers, it takes about 45 minutes of uptake time. During that time, you will be in a room with a magazine and a television, and you'll be able to just rest while we wait for the uptake time.
Okay.
Then you'll be brought in where the equipment is. It is actually similar to a CT scanner in that it has a donut, it has a hole, and you have to go through it. And the length of time it takes depends how tall you are. So if you're very tall, it's going to take a little bit longer because we have to go all the way from your eyes all the way down to about your knees. And if you're short like I am, it's going to not take as long.
Oh, I guess the short ones have the advantage.
Yes. So in general, most scanners 20 to 25 minutes. But your head won't be in it, but very, very short period of time.
Okay.
The rest of it will be down from your eyes down.
All right.
And then you'll be free to leave, and there'll be no side effects afterwards. You won't feel funny. You can go out for lunch, and you can enjoy the rest of your day.
Now you said they had to be free of food and water for 6 to 8 hours. Is that just a fasting the night before?
Yes.
All right. All right, perfect. And then what advantage is there to undergoing a PET CT scan other than what you've already mentioned?
Well, traditionally and still, many oncology patients are studied with traditional CT scans, mostly of the neck, chest, abdomen, and pelvis. When you look at a CT scan, you're looking at only size and sometimes changes in the shape of a tumor, but that could be, once that tumor is treated, it may still be growing as it necroses, but it doesn't mean it's an active tumor. Or it could be a very small mass. CT interpretations are done by size, so you could have a very small lymph node or a place that the tumor can spread to that's below 5 or 8 millimeters, and it would be considered normal on a CT scan. But once you add in the radioactive sugar, we don't have that problem because we can see that the sugar is metabolizing in the site of the tumor. You can only do that if you have the test done as one entity. So it's much better for the doctors, because the referring doctors, because we can monitor your treatment. So if you have a PET CT study done at the time of diagnosis and you undergo treatment, whether that be surgery, radiation, or chemotherapy, we can tell if you're responding to the chemo, or if you or whether the tumor was completely resected at the time of surgery. Because if there's metabolism or sugar left, there's still tumor that needs to be treated, or you may not be responding to the type of chemo that you're currently administered.
Okay. And then in which clinical situation would a PET CT scan be administered?
In almost all cancers, it is now approved and used for initial staging. That means at the time you present, to be sure. So if you come in and we see something on your chest x-ray or CT that has a mass, we don't know if it's just confined to the chest. So we will, about 40% of the time, we will upstage the patient. So they come in and they think it's local disease, but it is not local disease, which completely changes management.
Right.
We then, the second indication is once you've had either surgery or you're on therapy, to monitor the response to the treatment. And so we do it in follow-up to determine whether we see any more cancer, or the patient is or is not responding to treatment, so it needs to be changed.
Okay. And then we talked about radiologists in another interview that we had. What kind of radiologist would be specific to this type of exam?
Well, it's a very difficult exam to interpret, and it should be done by what we call an oncology radiologist or an oncologic radiologist. That is someone who is training in both the anatomic imaging, which is CT, but also in the metabolic or physiologic part, which is PET. So it should be a radiologist who can interpret both of those exams, and that is a PET CT.
And the PET CT or the PET exam itself is used for all different types of things.
It's used mostly for cancer. There is some work we do in cardiology, and we do a lot of work in neurology, particularly in the field of Alzheimer's.
Oh, that's great. All right. Well, thank you so much for the information. It was very nice to see you.
Nice to meet you.
And remember, if you want additional information about what we just discussed, please visit radnet.com.